This video is for any woman or a couple who is trying to get pregnant and they don't know what to do and they're at a crossroad. Most women, unfortunately, do not know much about their body and how their body works, right? And most of them end up getting information from non-credible sources, and they end up with a lot of wrong information and do the wrong things. All right, so my job as a gynecologist is to teach you how your body works as a woman and what to do if you are trying to get pregnant. Okay, so take a few minutes, listen to this video, follow me for more educative video, and share. My name is Dr. Parker Alote, gynecologist specialist. If you want to see me, you can just check my bio for my contact details and get in touch on WhatsApp or a call. Okay, so what do you do if you are trying to get pregnant? The first and important thing is, one, you should know your cycle very well. All right, your cycle, your menstrual cycle should be predictable. All right, that means you should be able to predict that, oh, my menstruation is going to come on 15th February, it will come on 15th February. Maybe 1 or 2 plus or minus days is okay, but you should know your cycle. That is the first thing. Your cycle should be regular. If your cycle is not regular, it changes so many times, changes often, there's something wrong. You're probably not ovulating, so pregnancy is going to be very, very, very difficult. And talk to your gynecologist about any medication you are on. There are certain medications that you don't take if you are trying to get pregnant. Let's say you're hypertensive, or you're diabetic, or you have epilepsy. Some of the medication, or you have depression, some of the medications you may be taking is not good to take when you're trying to get pregnant, because if you get pregnant and you're on those medication, it may affect the development of your baby. All right, so talk to your gynecologist, and maybe those medications could be changed. All right, and start taking folic acid. Now, folic acid, a lot of women think folic acid improves their fertility. That is totally wrong. Folic acid is mainly taken because of the baby, all right, to help prevent certain things we call neural tube defect. So every woman in the reproductive age who is trying to get pregnant should be on folic acid. If you are taking certain medications like epileptic medication, the doctor may increase the dose for you. So make sure you speak to your gynecologist and start taking your prenatal vitamins, all right, especially the ones which has omega-3. Studies have shown that omega-3 is very good for the development of the brain and the central nervous system of the baby. So you might like to take some omega-3 also. And diet, your diet is very, very important. Eat more of plant-based food, a lot of fruit and vegetables. All right, you just have to be healthy. These things are rich in antioxidants, which helps your ovaries to also function better and prevent oxidative stress. Take more organic food. Try and avoid the processed food like the sugars and the sodas and all those things which are rich in toxins. All right, because this may not be good for you. So your diet is very, very important. All right, and track your cycle. Tracking your cycle means you know when your menses will come, you know when you are fertile, you know your fertile window, and so you know when to have sex. All right, remember, the egg only lasts for 2 days when a woman ovulates. It doesn't keep long. Your chances of getting pregnant are highest when you have sperms in you before you even ovulate. So learn to track your cycle. If you are not aware of that, when you visit your gynecologist, let him take you through. Sex is very also important. A lot of women want to get pregnant, but they don't like having sex. Now, if you don't like having sex, it will be difficult to get pregnant. You should be having sex at least 3 times a week. If you have pain during sex, and that's why you don't enjoy sex, see your gynecologist so that we can evaluate you and see why you are having the pain, and then we help you out. But sex is very important if you are trying to get pregnant. Now, if you smoke, try to stop it. If you take alcohol excessively, also try and stop it. That is not going to help you much at all. All right, and if you're above 35 or hitting 35, pregnancy is not coming, see your gynecologist early. And the men, always go with the women. Don't think that you've had a child before as a man, so everything is right with you. No. All right, your semen may need to be checked. Maybe it was well some time ago, but it may not be well at the present time. Okay, so these are some few steps you need to take if you are trying to get pregnant. Go through the video again, list them down, and make sure you are going by these things I've just said. Thank you very much. Have a lovely day.